Hey everyone, it's Dr. Rick. Today's tutorial is on cannabis for potential improvement in outcome of bad viral infections. So the data on CBD, which is primarily what I'm going to be talking about, and coronavirus is really limited. I mean, most of the data that I use comes from NIH and or University of Tel Aviv. Israel has a lot of information because they have accepted the fact that medical cannabis is a medicine and it's not federally illegal like here in the United States. So it is limited. There's not that much data with US-based research institutions. However, we can extrapolate, and which is what I'm going to do today. If this is the first time you're finding me, don't forget to hit the subscribe button and pass this on to people that might be at risk, that might be using medical cannabis or recreational cannabis in the state of Illinois. If you're outside of Illinois, maybe you can apply this. So I'm just going to go through a couple things. So in Illinois at this point in time, we've moved from a diagnostic testing mode to a screening testing mode, and I'll probably do a video on that in the future as far as coronavirus. First it was diagnostic and to find disease in sick people, then it was screening to find disease in not so sick people. It should be universal, but we're still to the debate of who has which test and how do we get it. So bottom line is that if you, I've just removed myself from the politics of that, and I think that most patients will do okay. If you look at the population of the United States, I think the likelihood is high that we'll have a quarter to half of the population of the United States, which will be about 75 to 150 million people infected. But still, if you look at the data that's coming out, there might be maybe a 1% chance of death if you're in that group. And that's still a low possibility of death. So here's what I would do. Since we're kind of chasing this thing around and there's no cure, they're working on the use of antivirals like it found in HIV, and the trials are going on. They're thinking about fast-tracking FDA approval for a vaccine, and they're thinking about maybe utilizing old medicines to possibly get improvement in outcome. And essentially the outcome, the worst outcome is a cytokine storm. So check out my video on cytokine storm and see what happens. I think that the United States is really good with the intensivists as far as supportive care. So if you have the disease, really good chance that if you have access to a hospital, you're not in the province or the rural area, that you should do fine. Because most people, it's a self-limited disease. So the problem is you have to be under the scrutiny of an ICU doctor, an intensivist, a team that takes care of you, and a machine, and then IV stuff in case there's a secondary problem like an infection. Maybe that'll last up to 2 weeks and then you'll come out of it. The problem is if everybody goes at the same time, you've overwhelmed and overrun the hospital system. So that's what we're worried about as far as taking the curve from high peak where everybody goes to a lower peak where you just trickle in. Well, I'm not sure it's going to be a trickle in, but you fill up all the hospital beds and ICUs and you empty them out, and you fill up for the next surge and you empty them out. So if you have one surge at a time and without overwhelming, might be good. The only variable I see that could be a problem is when the healthcare workers and the EMT guys and the nurses and the administrative people get sick. There's not that many doctors around, and nurses, so that could be an issue. However, stepping past that, and we'll see the debate occur, and we'll see CDC changing policy every couple of days. However, my best support for my patients would be, let's prepare for worst case scenario, a cytokine storm. And if we start to melt the lungs and we can't breathe and you don't get to be plugged into a respirator, a mechanical ventilator, then what can we do to improve outcome? And again, this is not well studied, but I'm putting together a couple things to see if risk versus benefit if we can improve. And in theory, in my small brain, I think it's possible with my other videos, in addition to what I've found. So here's the argument. So the idea is if you are using medical cannabis for inflammation, for anxiety, for autoimmune disease, then you are already, you can take your choice of what and how to use product. I always suggest high CBD, and I'm going to explain why. So let's just start with what we have found so far. And indirect information shows improvement in outcomes as far as viral hepatitis. Specifically this paper, and that's the paper if you want to look at it. So it showed that with viral hepatitis, CBD use, and all these studies, it's weird, but all of them come out to about the same. Having a CBD level of 10 micromolar in the bloodstream seems to be a universal number, just with the limited amount of data that I found. So the idea would be if you have HIV and you have neuropathic pain and or disease like that, the CBD can be helpful. This paper goes on to find that CBD use also induces cell apoptosis or cell death. And I've talked about CBD use and THC use with cancer, so I'll put a link down below. Hopefully I remember that. But the cool thing is that it decreases inflammation. And all these studies will, spoiler alert, it shows decreased inflammation. So the idea is if you can decrease inflammation, you might be able to stop the storm. The cytokine storm and the leaking of the lungs and the pulmonary edema and the difficulty with breathing is all because those cells, ACE2 cells in the lung, become hit by the virus and they don't work properly, so you can't get oxygen in to the body. So some machines can breathe for you, but if we can decrease the inflammation response, might not have the virus destroys those ACE2 cells. That's my theory. So that's just it. So essentially macrophages and T cells can be controlled with controlling the inflammation response. This is also with regards to people using antiviral therapy for HIV, and it showed positive outcome as far as gut, finding it in the gut and finding that the lymphocytes, the T cells in the gut, were tamed when these patients had CBD in their system. Again, there's a study protocol that was used to show, to administer and show the decreased white blood cell response. So I think it's also a good paper. It is specifically targeted or found IL-2 was decreased, which could be a good thing. If you decrease IL-2, interleukin-2, by decreasing inflammation, you might be able to control that storm. The only downside is this. This study showed, it did more evaluation of the inflammatory response, but it showed that when you turn on or use medical cannabis, both the THC for CB1 receptors and the CBD or cannabidiol for CB2 receptors, those are the only two receptors you have in the endocannabinoid system that we have. Again, the bottom line is you decrease inflammation. So if you decrease inflammation, you'll tame white blood cells, macrophages, B cells, T cells, and that could be a good thing. The only problem is you might also increase, although you're cutting back on the response of the infection, the body to the infection, you might increase the amount of virus that exists in the body, if that makes sense. If you get infected by a virus, the body responds to one single virus by sending out its bouncers, and it's the immune system. Immunomodulation is what we're talking about. If you control the immune system, then in theory the virus is there, can do limited damage, but it can infect, and more virus will continue to propagate. But if you have two options for treatment, one is to control the virus, which would be important for the population. The other option for treatment would be to control the inflammatory response, which would be important for the individual. So if you control the virus, cool, but if you can't control the immune response, you have a patient that dies. So controlling the virus, you have a population that lives. Not controlling the immune response, you have an individual that dies. Here, you will still theoretically, this is my deduction, you will still theoretically knock off the reason that people die, which is a cytokine storm, in my opinion. But you might shed more virus particles and you'll spread it to everybody. So as I mentioned, if the data is correct as far as 25 to 50% of the United States population getting infected, that leads to approximately 75 to 150 million people getting infected. And if you look at the statistics from China and Italy, 1% to 3% of those that are infected can die. Hopefully, with the supportive measures that we have in the United States and the healthcare system in the United States, we might be able to maybe change the presentation compared to South Korea, China, Italy, Iran, maybe. I have optimism that we can do that. The only problem is sticking to social cues of staying, hunkering, or staying in place. I mean, I have enough of a problem just telling people to not eat fast food and exercise and go do mindful practice. And certainly the threat I sometimes will have to resolve to say, hey, your cholesterol is getting higher, or your anxiety is more out of control, or your diabetes is getting worse, or your weight is getting worse. It's sometimes the threat, I don't like using threat, but sometimes it's a motivator to make change. Because the usual suggestion back at me is, I don't have time for that, I don't have that money for that. Okay, fine. When you're ready, come back and see me, because you're going to have to be ready sooner or later, or else the disease will progress. Same thing with the social distancing and lockdown at home. I was out yesterday, I went to a hike, because we're allowed to do that, but on the way to the hike, there were decreased cars on a Sunday, but I still saw a couple of parking lots that were full. So I hope in Illinois it contains itself. I don't know how New York and California are doing. I've heard even with lockdown, you still have people that are gathering. So we'll see. So bottom line is that if we can't even hold that back, then we have to do something. And it leads me to this. Again, if you can prevent the possibility of a cytokine storm, you might beat everything, or the biggest side effect of this virus, in my theory. So this one is just on what cannabis does with viral infections. Good paper if you want to read it. Bottom line is it points out the mechanisms, how it controls inflammation. I don't know if you guys like, I don't have time to splice stuff, so that's why I'm holding these papers up, although I'm killing trees. So you block the inflammation, you'll have less inflammation, which is good. Might have more viral particle, which is what I've alluded to so far in my presentation, my thesis, but you'll beat the cytokine storm, I believe. So, so the other problem that comes up, if you control inflammatory response, you will accumulate viral load and latent infections like herpes, shingles, that might pop up because you've controlled immune response, if you get it. Because the only thing that controls the expression of dormant infection, EBV, herpes, is the immune response continuing to beat down the cell that's infected by those viruses. I know it's totally different than coronavirus, but just FYI. So again, in support of controlling the cytokine response. Let's see. Also, another paper that presented, I'll be done with these soon. Another paper that presented ideas on immunosuppression. Delta-9 THC is important. That's the part that is psychoactive. And then CBD is important. That's the inflammatory, non-psychoactive part. I'll show you my non-psychoactive suggestions here. In addition, sometimes if you control inflammation, you also control dopamine function. And dopamine is a hormone, you've probably heard about it. It gets you satisfaction, helps with the immune system and overall all systems. This is something called the HPA axis, hypothalamus pituitary axis. That's the body's thermoregulator, through your thermostat that you adjust every morning depending on how cold it is inside, how cold it is outside, how humid it is. You go downstairs and you adjust the thermostat. Well, this is the thermostat, the hypothalamus and the pituitary. The problem is sometimes when you're totally stressed out, the hypothalamus and pituitary don't work after a while. So that's why my patients with chronic fatigue have the weirdest symptoms. Fast heart rate, diarrhea, constipation, get sick all the time, depression, anxiety, massive throttling between the two. So it is important to control the HPA axis. And for those of you who are being stressed out by this corona infection, getting good sleep and controlling anxiety response would be important. Social isolation does lead to increased depression. So if you are depressed, it might help using medical cannabis, but the problem is it's not as robust. The information is not as robust as medical cannabis helping anxiety. You definitely have a lot of people that are reading the news and getting totally anxious, and I was buying into that too. Say, oh my God, I'm going to die with this thing. But statistically speaking, it will probably not happen. So it takes a lot of reinforcement to do that. Meditative practice. We're stuck at home. I don't have my usual church to go to. I can't go into the forest. Well, I can go in the forest like I did yesterday, but it's going to be more and more limited as we get through this. So and just to explain that, usually the endocannabinoid system, the ECS, will take care of itself. Anandamide and 2-AG are two hormones that we produce without taking medical cannabis, and they work to balance the body. But when the endocannabinoid system is off because you can't sleep, you're totally stressed out, you're hungry, or you're eating the wrong kind of food, or drink too much alcohol, that'll be off. So how do you reset that? You can support it. You can support the anxiety or the PTSD with medical cannabis by turning off the amygdala. You can also support the mood a little better, so you don't go from depression to anxiety to depression to anxiety by listening to all the news broadcasts and seeing the president online. By flattening that. So the flattening of the curve of the infection, you can also flatten the wide ranges. Instead of going like a roller coaster, you just go up and down with regards to anxiety, depression, anxiousness, or sadness. It's a little bit better than anxiety and depression. Anxiety, depression, anxiousness, and sadness. If it's easy to modulate, you'll do better. Your HPA axis will work, and your white blood cells will work the way they're supposed to. Almost done. This is just information to support the use of CBD in cancer, and I've talked to you about that before as far as Kaposi sarcoma. And then finally, let me just get this one. Oh, finally, that's. I'm just going to drop the rest of these, but I'm going to show you the products. Hopefully you're following, but I would also say that it's important to consider, because of the way this infection hits people, it's important to consider oral versus inhaled. For those of you who use smoking the flower or using shatter, the vape from the resin that's melted off and inhaled, or using the regular vapes of oil, I would be careful, because definitely smoking the flower increases your chances because of the tar and the irritation to the lungs, increases chances of those ACE2 receptors being really fired up. And then when you get the corona, the higher likelihood that you'll progress on to something pulmonary or lung related. Vape, not as bad as smoking, but still vaping does increase your chances. This is a vape product, and this is mostly CBD, so it doesn't really give any psychoactive. However, it does get you CBD. The only problem with using a vape instead of a flower is that it's more expensive. And some people like the high, especially my PTSD guys, they like the high of the flower. It's cheaper, they like the high. The vape might not get you as high a content of THC. Specifically, this is for CBD, but I brought this vape up because some people will try to vape to get their CBD levels high. I don't think that using an inhaled form of CBD will really sustain high doses of CBD in the bloodstream. And again, if we want to control the immune response, you have to have high levels. All my patients with fibromyalgia and chronic fatigue and or rheumatoid arthritis, they know, or Crohn's disease, they know they have to maintain CBD twice a day, maybe 3 times a day during a flare-up. So I think it goes away really fast when you use a vape. So that's why I usually go towards orals, and used to like taking Avexia. So those of you who follow me, you know what I take or what I've used in the past. I used to like taking Avexia, half tablet twice a day, and the milligram dose is comparative to tincture, but not at the same number to number measurement. So this is nice, 14:1, mostly CBD, a little bit of THC, will not get you high, but twice a day will control inflammation. If you can't afford the tablets, that bottle of 40 will last you 40 days. $50, I think. If you don't like or can't afford the tablets, you can go cheaper with oil, but oil tastes weird. Sometimes if you use, these are my two favorites, Spectra high CBD, and then Matter tincture, tangerine flavored. I have another one, Mary Medicinals, but that's really expensive. Super concentrated, about 500 milligrams of CBD. This is about high 200s. This is middle to low 200s as far as milligram dose of CBD. So twice a day. This would be half a dropper, a quarter dropper. This would be half a dropper. $60 and like $40, but it should last you about a little more than a month, almost 2 months. There's also stuff that you put into carbonated water. This is nice, but I think it goes too fast. There's also, you can spray, this is cool, I haven't tried this, I'll do an unboxing maybe today. You can spray this under the tongue, mostly CBD. Should last you, again, I would try to get this, if you go CBD under the tongue and then swallow whatever's left, should get to pretty decent levels, because under the tongue administration goes straight to the blood vessels if you have good mouth flora. There's also orals. I haven't done a video on this yet. What are these things? These are, I don't even know what these are. I think they're gummies. I haven't opened this yet, but again, CBD twice a day. CBD twice a day spray, CBD twice a day gummy. And finally, so that's what I would try to get to, is an oral version of it. Even if you're still relying on the vape, that's fine. Really, if you're on flower, try to switch over to a vape of your strain that you like. Bubba Kush, Gorilla, whatever it is that you use. I would, for this next couple of weeks, I would try to get into, we're gonna spike or surge soon, so I'd try to get into a vape. Those of you who use my older patients who use the topical, it does feel great, CBD dominant, but you're not gonna get it into your system. Even if you have thin skin, I don't think it'll accumulate decent enough levels, 10 micromolar, to maintain anti-inflammatory states. So I would probably continue, just like you continue vaping, but I'd add all the other orals I mentioned. And then finally, thanks for listening. There's nice data that says if you, this is my oil, omega-3 oil, there's nice data that says if you take your cannabis product with oil in your belly, it might absorb better. There's also data that says if you take it with a probiotic, it might, especially the orals, not the inhaled, because you don't inhale through your gut, but if you have this in your belly, it might make the inflammatory response decreased in your belly. Remember, coronavirus is not just the H2 receptors in the lung, it's also H2 receptors in the heart, H2 receptors in the colon, or the digestive system, and other organs too. But that's why if you make it past the cytokine storm and the pulmonary failure, or severe acute respiratory distress syndrome, SARS, you will still have, there's data coming back from the last SARS infection, and there's still people with residual heart problems. I'm not sure about the colon problems, but I'd say bolster up the immune system, and the immune system is mostly in the digestive system. So if you make the digestive system better with oral CBD and maybe a good probiotic, I don't always use this one, Saccharomyces, but it has been shown to work on TNF and interleukin, so it does decrease inflammation. Switch over to a different one. I'll put the video I did on the probiotics. So hopefully this gives you some good information. Stay safe out there. If you have any comments on how you switched over from flower to vape oil to oral, please put them down below. Otherwise, I'll see you at the next tutorial.